All right, so hi, I'm Dr. Tom Hagopian. I am a board certified plastic surgeon in Atlanta, Georgia. And I need to film some interesting stuff about me because people want to know things, I guess, about me. So my background, I have a kind of unique background in going into medicine. I was born in Miami and then raised in West Palm Beach, Florida. That's kind of where I spent my whole life. I went to the Fort Atlantic University for undergrad, but being a doctor was not my first career. Actually, coming out of high school, my first career was meter reading for the power company, which that doesn't even exist anymore. We used to walk house to house and read the power meters and stuff. It was crazy. But then I decided I wanted to be a fireman, which is what my dad did, and I thought it was really cool. So I went to EMT school and I loved it. And then fire academy, where you actually learn to fight fire and stuff. That was, it was really scary and a lot of work, but I got through it and we did it. And then I went to paramedic school and I really enjoyed it. I like the medical aspect of it a lot more than I like the firefighting, turns out. And so that kind of led me into medicine. But I already had all the certifications. I was like, well, let me work for a little bit. I'll get some experience under my belt, and then I can go on and go to medical school after that. So I started working as a firefighter and a paramedic down in South Florida. I did that for 4 years professionally. And then I did that well. I went to undergrad, got a degree in chemistry and biology, and then eventually went on to medical school at Emory University. So I was a professional firefighter. It was my first career. And then in med school, I knew I really loved surgery. I had a kind of picking where I was going to go. I thought about doing trauma surgery for a little while, but that's not for me. It's very scary and people are really sick. So, and then I decided plastic surgery was more my speed. And then I did medical school at Emory University. I eventually went on to residency at the University of Southern California in Los Angeles, where I did a 6-year integrated plastic surgery residency. And that's my background. I love plastic surgery. It's super fun. I get to operate everywhere, do a lot of cool stuff, a lot of instant gratification, which we all like, but a lot of really happy people, which is kind of the cool thing about our field. That's my kind of unique background going into it. That's kind of how I got here. The OR music. So I like energy a lot, and I grew up listening to heavy guitar music and rock and hard rock and stuff like that. So I like to listen to a lot of that in the OR. The nurses in the OR don't particularly care for that so much. So we like to trade off because I like to be a team player in the OR. So sometimes we'll listen to rock and metal, and sometimes we'll listen to pop, and sometimes on Mondays we have our circulator really likes K-pop, and so we'll listen to some K-pop here and there. The only thing we don't listen to is country. No one likes country in our ORs. So if you like country, it's nothing against you. It's just we all just don't. Snacks. So I do like snacking a lot, but we are in the Krog district. So one of the reasons I moved the practice to the Krog district in Atlanta is because Krog Street Market's right here, and it's amazing. There's so much good food everywhere, all on the Beltline. Some of our favorite spots, we like breakfast spots. There's a place called Sun in My Belly. We love going there all the time. We can take our dog, Emory. He's on the website if you want to see him. But he's a cute dog. We go around different places that are dog friendly. One of our favorite things to do though, and this sounds really weird, but my wife and I really love the drive-in movie theater. So the Starlight Drive-In is kind of like a staple of Atlanta, and it's been here forever. And their sign doesn't really work anymore now. So if you go there, it's neon and it says Arl, because all the neon sign is broken, but it's awesome. You go there, you spend $20 and you drive in, and we bring our dog and we watch movies. It's really fun. Emory, I came during residency. So I was a 5th-year resident. I was at Cedars-Sinai Hospital in Los Angeles, and we had talked about having a dog or getting a dog for a while. And one Saturday, I think in residency, you only get 4 days off a month. And so one of my 4 days off a month, I was like, Chelsea, we should go get a dog. Let's go to this rescue that's going on over at PetSmart. And so we went, and there Emory was. He was this big. He was 8 weeks old. And Chelsea picked him up, and she's like, yeah, we're not leaving the store without this dog. And so that's what happened. And now we have a dog. But he's great. He's super fun. He's friendly. He bites sometimes, which is why he's not around as much anymore. But he's generally a good dog. So we get this question a lot. How do you find or pick a plastic surgeon? It's actually kind of hard. It's not as straightforward as you might think it is anymore. So the number one thing you want to look for in a plastic surgeon is make sure they're board certified. What does board certified actually mean? Because now we have to get into this, because there's a lot of boards that are not real boards. What do I mean when I say real boards? In America, you go through, the way medical training works is you do undergraduate, that's college, and then you do medical school. Everyone goes to medical school. And then doctors go into a residency program. Residencies are basically postgraduate education where you learn how to be a surgeon. So if I do a general surgery residency, I learn how to be a general surgeon. I do a plastic surgery residency, I learn how to be a plastic surgeon. And that's what I did. I'm a plastic surgeon, I did a plastic surgery residency. There's a couple different ways to do plastic surgery residencies, but basically if you become a plastic surgeon, to become a board certified plastic surgeon, you have to have done a plastic surgery residency. There is a governing body in this country, they're called the American Board of Medical Specialties. They basically set the standards, and there's a rigorous curriculum for how residency works. They say, if you want a plastic surgery residency to be accredited by us, you have to do all of these things. And it's pretty extensive and exhaustive, and it's very expensive, and it takes a lot of time. And there are only a couple specialty boards. There's like 23 recognized specialty boards or something like that, some number. So, but you can still start a board that is not recognized by them, that just decides you can be a board, and then you can certify people to become board certified, but by a board that doesn't really have accreditation standards by the American Board of Medical Specialties. So, how do you tell what I consider the highest standard of training, which is a plastic surgeon, from somebody who is accredited or board certified by a board that could have any standards or even less accredited or rigorous standards than an ABMS board might have? You want to look for a board certified plastic surgeon. The only people that can really call themselves plastic surgeons in America are people that have a board certification from the American Board of Plastic Surgery. You can go on their website and you can look up using their Find a Surgeon tool to see if the surgeon you're considering is board certified. Now, there are a couple other boards that are also plastic surgeons that are what I would consider have great training for what they're trained to do. The American Board of Facial Plastic Surgery, those are ENTs or otolaryngologists that go on to do a fellowship in facial plastic surgery. They have very good training and they are good surgeons on the face. They don't really have any training outside of the face. So if a facial plastic surgeon wants to do a tummy tuck on you, you should be very skeptical of that. There's also oculoplastic surgeons. They are ophthalmologists. They're trained to perform surgery around the eyes. They do a great job for reconstruction and for cosmetic procedures of the eyelids. They have their own certifying board. But outside of those three, you really should be wary if you see, and particularly if you see cosmetic surgery. So the cosmetic surgery boards, in my opinion, aren't trained as rigorously as plastic surgeons are. And these are people that can be any surgical specialty: general surgery, neurology, neurosurgeons, they could be orthopedic surgeons, they could be OB-GYNs, and they do an additional year of fellowship with another non-plastic surgeon, and then they begin doing cosmetic procedures. I don't think they are as safe or as effective as a fully trained plastic surgeon, and my advice to you would be to avoid them. So that's number one thing you want to do. Once you found your plastic surgeon, they have the right credentials. What you want to do, go on their website, go on their Instagram, and look for the procedure that you're trying to get. So if you are trying to get a super specific eyelid, cat eye surgery or something, you want to go and see that they do this. Because we do a lot of things. I have the capability of doing, and I've trained to do a lot of different surgeries, but there are some surgeries I do a whole lot more than others, and I'm a lot better at them. Generally speaking, you want a plastic surgeon, our data says, to have performed this procedure at least 12 times a year. That's when you become really efficient, and the more the better. So look at their website, look at their before and afters for the procedure you're looking for. They should be able to show you pictures of someone that looks like you and have a really good conversation about it. And then look at their reviews. I don't trust Google reviews or Yelp reviews or Real Self as much, because there's a lot of manipulation that seems to go on among that. There's a lot of games. There's both ways, surgeons paying to remove reviews. I don't know if that happens, but I'm told it does. There's a lot of fake reviews, and then there's a lot of fake negative reviews from competitors. So it's like a whole game. But reviews can be important. It's good to look at them and see if someone has a lot of 1-star reviews, see why it's going on. And then just do a tertiary Google search of their name. Like, does this surgeon have 20 malpractice claims? Like, that's a problem. Maybe look up their license and make sure that they're, don't have outstanding investigations. It is not expected or common for you to have an investigation against your license. The vast majority of surgeons do not, and I would consider that a red flag. Yeah, but those are just generally good ways. So in summary, number one, make sure they're board certified by a reputable board, such as the American Board of Plastic Surgery. Number two, check out their website, their before and afters, their social media to see if they do the procedure that you do. And number three, check out their licensure and make sure that there's no pending investigations. Do a Google search of their name, make sure they don't pop up on the news. All of that is kind of the best way to go about it. Yeah, I think that's kind of my best advice. Chin lipo is one of the most common in-office procedures I do. It's really gained a lot in popularity over the last couple of years. I think COVID had something to do with that. You're kind of spending your whole time looking down on Zoom and all you see is your face and everyone gets a little self-conscious about it. What is chin lipo? So chin lipo is kind of exactly what it sounds. It's not actually liposuction of the chin, which is here. It's submental liposuction and jawline liposuction. Really easy procedure to do. It takes about an hour in the office. You do it under local. Some people get a little bit of light sedation, like a Xanax kind of thing, but most people don't even need it. You drive in, we get it done, and we drive out. It's awesome. What does it do? It is for people that have any fullness or a lack of definition in their jawline, for people who also have moderate to good quality skin. So this is not a procedure for somebody with a lot of extra skin under their jawline or chin. Those patients need a facelift. But if you're young and you just have some fullness here and you don't like the way it looks, chin liposuction is an excellent procedure. What are the alternatives? So a lot of people call and ask about Kybella or cool sculpting. I personally think chin lipo is almost always a better option for people. Cool sculpting is great. It's a little applicator you put in it. It's a cool mini. It gets rid of about 25% of the fat, but you got to do it more than once. Kybella you have to do up to 6 times, and that's an injection pattern into that area where you inject a fat dissolving acid. I don't like Kybella at all. I think that that is not the way to treat it. By the time you do 6 procedures, you may as well have paid for chin lipo. You probably could have paid for it a couple times at that point. Chin liposuction is permanent. There is no retreatment necessary. The risks of chin lipo are pretty minimal. Scar banding and some kind of textural issues to the skin are possible, and then there's really rare risks. But otherwise, it's a very safe procedure, safe to do in office. Really popular, especially among young people, and there are some pretty dramatic results if you pick the right patient. I think you see online, like if you ever go on Reddit, which is kind of where a lot of my chin lipo patients come from, you'll see like all these complications, and I always kind of think, oh man, I probably wouldn't have done chin lipo on that person. That person probably needs a facelift. So that's why it's important when you're looking at somebody to do chin liposuction, you want to make sure you're going to a board certified plastic surgeon for that procedure, because we'll be able to tell you, yeah, you probably shouldn't do that. You should do a facelift. Whereas if you go to some people and that's all they do is lipo, that's all they'll offer you. And then if you're a hammer, everything looks like a nail kind of thing. So you want to go to somebody who has an idea of all of the options so they can steer you right, because it is one of those procedures that if you're not a good candidate for it, you're not going to have a good result. Anyway, I love chin lipo. Come and see me for a consult. Give me a call. It's one of the most common things I do. One of my favorite things to do because it's like just so satisfying. It really looks great.